You know, doctors are always reminding women how important it is to go to their OBGYN every single year. And now your visit might look a little bit different. The American Cancer Society has released some new guidelines that update how doctors screen for cervical cancer. And January is Cervical Cancer Awareness Month. This morning we are joined by Dr. Leslie McCluskey, a SLUCare OBGYN. Good morning to you.
Good morning.
We'll talk about these new guidelines. What is changing for women?
So the American Cancer Society recently revised their recommendations for cervical cancer screening, and there's many major organizations that give guidelines, but the American Cancer Society, along with the American College of OBGYN, the most recent guidelines were in 2012, but the American Cancer Society updated a few months ago to changes where instead of starting at the age of 21, we start screening at the age of 25. The other major difference is instead of using pap smears every visit, instead we use testing for HPV virus, or human papilloma virus.
Mm-hmm. And that starts relatively early for some youngsters, right? To get not necessarily the testing, but the vaccination against it.
Yes, I can't say the value of the HPV vaccine enough, as HPV has been basically implicated in almost every cervical cancer that we see. It causes almost every precancer change and almost every cancer. So that new news that we've basically discovered over the last 20 to 30 years has made a big difference in our screening, as well as the extreme importance of prevention of HPV. And one of the largest ways to do that is to have the HPV vaccine given before sexual activity occurs.
Mm-hmm. So why is it important for women to keep up with their annual exams? I mean, some folks might be reluctant because of COVID. They might say, I feel fine, everything's good. Why should they keep up with that?
Yes, that is a really important thing that we need to remember to remind our patients. The annual exam or yearly exam is a chance for so many things to be examined as well as discussed. We talk about issues with menstrual periods, with infection testing. We talk about contraception, as well as the breast exam and pelvic exam. A pap smear or a test for HPV is only a part of the pelvic exam. It's an important part when it's deemed time for that, but the rest of the exam is also very important.
Yeah, some very important information. We sure appreciate you joining us, Doctor, so much. And if anyone else wants to read more about this and update on the cervical screenings, we will have a link on our website as well as our Fox 2 mobile app. Have a good day, Doctor.